Welcome to The Explainer. Today, we're going to dive into a problem that sounds super technical, but it's actually about something incredibly human: medication names. We're going to look at why getting one word wrong can be a huge safety issue, how some amazing new AI tools are helping fix it, and, well, why that fix might be leaving most of the world behind. All right, so let's just jump right in with a question. How can a single, simple name for a medicine actually create confusion and even put patients at risk all around the world? It sounds like it shouldn't be possible, right? But the answer to this really uncovers a massive challenge in global healthcare. So, first things first, let's get into the background of this whole thing, this global naming problem. It's one of those hidden issues, but it has a huge impact on the safety of medicine that you or your family might take. So here's the thing. Different hospitals, different pharmacies, even different countries all use slightly different names and descriptions for the exact same drugs. And that ambiguity, well, it's not just confusing. It can lead to some really dangerous medication errors. So what's the answer? Well, it's all about creating a universal standard. We need a common language, a way to make sure that a doctor in Toronto, a pharmacist in Tokyo, and a researcher in Lagos are all talking about the exact same medication every single time. Okay, so that's the setup. Now, let's really nail down the problem itself. It all boils down to what we can call the granularity gap. And this is where we meet the two main players in our story and see why they just don't speak the same language. Okay, so on one side, you've got the International Nonproprietary Name, or INN for short. Think of this as the simple, universal name for a drug's main active ingredient, something like metformin. It's fantastic for global recognition, and it's managed by the World Health Organization. But then you've got RxNorm, which comes out of the U.S. National Library of Medicine, and this system is way, way more detailed. It doesn't just say metformin, nope, it gets super specific. Metformin 500 mg oral tablet. See the difference? And this analogy just hits the nail on the head, right? The INN gives you the basic ingredient, which is great for a general idea. But modern digital health systems, the ones trying to prevent errors, they need the exact recipe. And that's what RxNorm provides. Yeah, and this table just lays it all out so clearly. You can see right here that INN is designed for global human understanding, while RxNorm is really built for precise computer communication. And that difference, that gap in granularity and purpose, is exactly why we need to build a bridge between the two. Okay, so we've got our problem. How in the world do we fix it? Let's get into the analytical approach. How can we possibly translate this simple global language of INN into the super detailed computational language of RxNorm and do it at a massive scale? The answer is a process called mapping. And, for years, this has just been a brutal, painstaking manual job. You had human experts helped by some pretty complex algorithms, literally sitting down and trying to connect millions of local drug descriptions to the one correct, specific RxNorm code. Now, these traditional methods, they were pretty good, They achieved an accuracy somewhere between 83 and 92%. But let's be real, in medicine, pretty good just doesn't cut it. And that gap, it still left a mountain of work for human reviewers. But now, a new analytical tool is completely changing the game. I'm talking about large language models, or LLMs. Yep, the exact same AI technology that powers tools like ChatGPT. So by training these incredibly powerful language models on huge medical databases, mapping accuracy now consistently gets over 90%. And that's even for really complex and multilingual international drug names. It's a huge leap. And this is the so what. The efficiency gain here is just staggering. This chart really says it all. This technology promises a massive, massive reduction in the manual labor, which means saving incredible amounts of time and money to get this vital data standardized. In fact, some studies are showing this AI-driven approach can slash the overall labor needed for these kinds of projects by over 75%. That's not just an improvement, that's a revolution for health systems, a total game changer. So everything's looking great, right? We have the problem, and now we have this amazing new solution. But hold on. Just when we think we've got it all figured out, our story takes a major turn. And this brings us to a really critical set of challenges that shape our final recommendations. And here's the gut punch. This amazing labor-saving solution is basically inaccessible to most of the world. There's this stark digital divide between high-income countries, with all their mature digital systems, and low- and middle-income countries, which are often dealing with fragmented systems and really limited infrastructure. And this table really breaks down the problem. Low- and middle-income countries face these huge barriers. It's not just the high cost of running AI. There's an even more basic problem. RxNorm is a US-based system, so it often doesn't even include the essential, locally produced medicines that are used every day in these countries. And that brings us to this central paradox, the real tragedy of this whole situation. The very countries that would benefit the most from this incredible technology, the ones with the fewest human experts to spare, are the exact same ones who can't access or implement it. So, where do we go from here? Well, that brings us to our final section, the recommendations. And the good news is, it's not hopeless. There are clear, actionable steps we can take to help bridge this digital and data divide. So what does that look like? Well, first off, the big international players, like the WHO, they need to step up and help develop a new, truly global standard, one that has the simplicity of INN but the detail of RxNorm. We also have to support cheaper, open-source AI tools that are tailored for local needs, invest in basic digital infrastructure, and set up ethical oversight to make sure these tools are used safely. So when you boil it all down, what's the big takeaway from all this? It's that harmonizing medication data, it's not just a techie job for data scientists. It is a fundamental mission for global health equity. It's about making sure that everyone, everywhere, has access to safe and effective medical care that's powered by accurate information. And that leaves us with a really critical question, not just for medication data, but for the entire future of AI in healthcare. And the answer to that question? Well, it's really going to depend on the choices we all make, starting today. Thanks for joining us.